Question 1. A nurse notes the suffix emia in a lab report. Which condition should the nurse prioritize for assessment? A. Leukemia, indicating cancer in bone marrow or blood tissue. B. Anemia, indicating low red blood cell count. C. Ischemia, indicating restricted blood supply. D. Bacteremia, indicating bacteria in the blood. Answer: D. Bacteremia, indicating bacteria in the blood. Question 2. A nurse understands that the suffix sharpen means destruction. Which patient needs immediate follow-up? A. A patient with hemolysis after receiving a mismatched blood transfusion. B. A patient recovering from electrolysis treatment. C. A patient undergoing dialysis. D. A patient with slight muscle soreness after exercise. Answer: A. A patient with hemolysis after receiving a mismatched blood transfusion. Question 3. The suffix ostomy refers to creating an opening. Which action is within the LPN's scope? A. Assessing stoma color after colostomy surgery. B. Changing a colostomy bag on a stable patient. C. Teaching a patient's stoma care preoperatively. D. Interpreting lab results for ostomy output. Answer: B. Changing a colostomy bag on a stable patient. Question 4. A patient has a diagnosis ending in ites. What is the primary nursing intervention? A. Assessing for signs of infection and inflammation. B. Monitoring for hemorrhage. C. Promoting bowel elimination. D. Evaluating mobility limitations. Answer: A. Assessing for signs of infection and inflammation. Question 5. The suffix ectomy refers to surgical removal. Which delegation is appropriate for a UAP? A. Repositioning a post-appendectomy patient. B. Teaching coughing techniques post-cholecystectomy. C. Monitoring output from a nephrectomy drain. D. Evaluating wound healing from a mastectomy. Answer: A. Repositioning a post-appendectomy patient. Question 6. The nurse reviews a report that ends in SCOPY. What should the nurse prioritize post-procedure? A. Monitor for signs of perforation. B. Assess for urination frequency. C. Encourage ambulation. D. Administer diuretics. Answer: A. Monitor for signs of perforation. Question 7. A patient is diagnosed with uralgia. Which assessment takes top priority? A. Monitoring for bleeding. B. Checking hydration status. C. Inspecting the skin for rashes. D. Measuring temperature. Answer: A. Monitoring for bleeding. Question 8. A nurse cares for a patient with part malacia of the trachea. Which safety measure is critical? A. Prevent airway collapse. B. Monitor for skin breakdown. C. Encourage fluid intake. D. Support joint mobility. Answer: A. Prevent airway collapse. Question 9. The suffix megaly means enlargement. What finding is most concerning in a patient with splenomegaly? A. Left upper quadrant pain. B. Dry mouth. C. Headache. D. Constipation. Answer: A. Left upper quadrant pain. Question 10. A nursing student asks about plasty procedures. Which example best illustrates this suffix? A. Rhinoplasty to reconstruct the nose. Balloon angioplasty to remove a clot. Colostomy for bowel diversion. D. Hysterectomy to remove the uterus. Answer: A. Rhinoplasty to reconstruct the nose. Question 11. A nurse hears arthrodesis during rounds. What does the suffix suggest? A. Binding or fixation of a joint. B. Inflammation of cartilage. C. Removal of joint fluid. D. Enlargement of muscle. Answer: A. Binding or fixation of a joint. Question 12. What suffix indicates a condition that may require seizure precautions? A. Lepsy. B. Scialgia. C. Nedynia. D. Pathy. Answer: A. lepsy. Question 13. The suffix penia means deficiency. Which lab value requires urgent attention? A. Neutropenia with ANC less than 500. B. Leukopenia with WBC at 5,000. C. Thrombocytopenia with platelets at 200,000. D. Erythropenia with HGB 13G per DL. Answer: A. Neutropenia with ANC less than 500. Question 14. Which nursing action supports a patient with a diagnosis ending in plegia? A. Preventing contractures with passive range of motion. B. Monitoring temperature every hour. C. Increasing fluid intake. D. Administering antiemetics. Answer: A. Preventing contractures with passive ROM. Question 15. A nurse notes phasia in the neurologist's report. Which action supports patient safety? A. Using picture boards for communication. B. Providing thickened liquids. C. Applying wrist restraints. D. Restricting oral intake. Answer: A. Using picture boards for communication. Question 16. What does the suffix stenosis imply about the patient's condition? A. Narrowing of a body structure. B. Excessive discharge. C. Tumor growth. D. Surgical incision. Answer: A. Narrowing of a body structure. Question 17. What suffix implies a benign or malignant growth that the nurse should monitor? A. Oma. B. Trophy. C. Algia. D. Lysis. Answer: A. Oma. Question 18. A patient is diagnosed with nephrolithiasis. And what does the suffix iasis imply? A. Presence of a condition. B. Inflammation of an organ. C. Enlargement. D. Infection. Answer: A. Presence of a condition. Question 19. A nurse reads a report with her RIA. What patient teaching is most relevant? A. Maintain hydration during episodes. B. Use ice packs for pain relief. C. Apply heat to swollen joints. D. Elevate legs while sleeping. Answer: A. Maintain hydration during episodes. Question 20. A nurse reviews a diagnosis ending in a seal. Which complication is most important to assess for? A. Tissue protrusion through a weak spot. B. Electrolyte imbalance. C. Inflammation of lymph nodes. D. Cardiac arrhythmias. Answer: A. Tissue protrusion through a weak spot. Question 21. A nurse is caring for a patient with the suffix ptosis in the diagnosis. What does this indicate? A. Drooping or sagging of an organ or part. B. Abnormal growth. C. Blood clot formation. D. Bone infection. Answer: A. Drooping or sagging of an organ or part. Question 22. The suffix tomi indicates a surgical incision. What is a nurse's priority after a tracheotomy? A. Maintain a patent airway. B. Monitor fluid balance. C. Promote ambulation. D. Reduce fever. Answer: A. Maintain a patent airway. Question 23. The suffix genic means causing or forming. Which statement shows correct nursing understanding? A. Carcinogenic substances can increase cancer risk. B. Pathogenic cells promote wound healing. C. Pyogenic bacteria reduce fever. D. Osteogenic therapy prevents fractures. Answer: A. Carcinogenic substances can increase cancer risk. Question 24. A nurse reads a diagnosis ending in phobia. What would be the most therapeutic intervention? A. Reduce environmental triggers of fear. B. Increase fluid intake. C. Restrict physical activity. D. Promote social isolation. Answer: A. Reduce environmental triggers of fear. Question 25. The suffix seal refers to herniation. Which condition is a priority for monitoring bowel obstruction? A. Enterocele. B. Hydrocele. C. Varicocele. D. Rectocele. Answer A. Enterocele. Question 26. The suffix plasia means formation. What finding in a patient with hyperplasia requires physician notification? A. Rapid increase in tissue size. B. Redness at fourth sight. C. Nausea after meals. D. Mild joint pain. Answer A. Rapid increase in tissue size. Question 27. A nurse encounters the suffix phagia. What patient behavior is most concerning? A. Difficulty swallowing. B. Urinary incontinence. C. Skin dryness. D. Muscle twitching. Answer A. Difficulty swallowing. Question 28. A patient's diagnosis ends with rhexis. What complications should be anticipated? A. Rupture of an organ or vessel. B. Joint stiffness. C. Excess mucus. D. Hair loss. Answer A. Rupture of an organ or vessel. Question 29. The suffix pathy indicates disease. Which task should not be delegated to a UAP for a patient with cardiomyopathy? A. Monitoring response to diuretics. B. Repositioning in bed. C. Helping with feeding. D. Assisting with hygiene. Answer A. Monitoring response to diuretics. Question 30. A nurse is caring for a patient with the suffix poiesis in their lab results. What process is being assessed? A. Formation of blood cells. B. Muscle regeneration. C. Bone healing. D. Hormonal activity. Answer A. Formation of blood cells. Question 31. The suffix spasm refers to sudden involuntary movement. What patient need takes priority? A. Preventing airway obstruction. B. Administering eye drops. C. Teaching deep breathing. D. Checking capillary refill. Answer A. Preventing airway obstruction. Question 32. A nurse sees aesthesia in a neurologic exam note. Which assessment is priority? A. Response to tactile stimuli. Bowel sounds. C. Skin turgor. D. Visual acuity. Answer A. Response to tactile stimuli. Question 33. The suffix urea involves the urinary system. What finding in polyuria should be reported immediately? A. Signs of dehydration. B. Elevated pulse rate. C. Warm skin. D. Decreased hunger. Answer A. Signs of dehydration. Question 34. A patient has a condition ending in crine. What does this relate to? A. Hormone secretion. Bowel obstruction. C. Blood clotting. D. Muscle wasting. Answer A. Hormone secretion. Question 35. The suffix harn, decease, means binding or fusion. Which task can the nurse assign to a new graduate after arthrodesis? A. Reinforcing mobility education. B. Assessing neurovascular status. C. Monitoring for DVT. D. Adjusting pain medication. Answer A. Reinforcing mobility education. Question 36. What is the best interpretation of the suffix oidon in thyroid? A. Resembling or like. B. Inflammation of. C. Pain in. D. Formation of. Answer A. Resembling or like. Question 37. The suffix iasis implies a disease condition. Which condition warrants contact precautions? A. Giardiasis. B. Osteoarthritis. C. Dermatitis. D. Fibromyalgia. Answer A. Giardiasis. Question 38. A nurse reads a report stating trophic muscle changes. What should the nurse observe? A. Muscle wasting or growth. B. Cardiac rhythm changes. C. Hair thinning. D. Elevated temperature. Answer A. Muscle wasting or growth. Question 39. The suffix amalgia indicates pain. What is the best non-pharmacological intervention for neuralgia? A. Applying heat to the area. B. Encouraging fluids. C. Giving a back massage. D. Providing a laxative. Answer A. Applying heat to the area. Question 40. The suffix side means to kill. Which statement best reflects proper disinfection practices? A. Use bactericide for cleaning IV sites. B. Use bactericide to treat infection. C. Use bactericide to sterilize equipment. D. Use bactericide to boost immunity. Answer A. Use bactericide for cleaning IV sites.
If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.